Hello, everyone, and welcome to another episode of Arthritis at Home. Provincial and territorial governments across Canada coming out of COVID-19 are literally transforming the delivery of healthcare to chronic disease patients across the country. We also know that there is a new deal between the federal government and the provinces and territories where over $45 billion are going to be transferred for healthcare over the next 10 years. As part of this transformation, there are rheumatologists and arthritis health professionals working together in Ontario to advocate and help remove barriers to arthritis care and promote evidence-based disease management for all people with arthritis. We have two of those leaders here with us today, Dr. Sahil Koppikar, a rheumatologist in Ontario, and Chandra Farrer, who is a ACPAC advanced clinician practitioner in arthritis care. Welcome to you both.
Thank you.
Thanks for having us.
Now, I'm just going to quickly have you both sort of introduce yourselves, let our audience know who you are and what you do in Ontario, and then we'll move to maybe some other questions and answers around an exciting initiative that you're both helping lead in Ontario. So maybe Dr. Koppikar, Sahil, I'll start with you and maybe just briefly introduce yourself.
Sounds good. So I'm an adult rheumatologist with a primary practice in Toronto at the University of Toronto. However, I also have a Northern Ontario practice in Timmins in a multidisciplinary care model. The program's been running for over 30 years, and I took that over about 4 or 5 years ago, where we have 2 rheumatologists and ACPAC therapists, and we take trainees to serve the Timmins community in Northern Ontario. I also co-chair the Northern Ontario Committee of the Ontario Rheumatology Association, along with Chandra here.
Great. And I'm Chandra Farrer. I'm an advanced practice physiotherapist. I work in Toronto and work closely with Sahil in our work on the Northern Subcommittee for the Ontario Rheumatology Association. And I am an ACPAC Special Interest Group Advocacy Chair as part of the AHPA.
Many of our audience members will know that ACE, Arthritis Consumer Experts, has worked closely in the past with the Ontario Rheumatology Association, the ORA, on a number of different initiatives. We're going to talk about this Northern Ontario initiative, and it's something that we have partnered with you on. And maybe to get us started, Chandra, you can just tell us maybe a little bit about what this initiative is addressing in terms of the gaps in arthritis care and rural remote issues for arthritis patients in Northern Ontario.
Okay. So there is a shortage of rheumatologists. The Canadian Rheumatology Association has a benchmark where they recommend 1 rheumatologist for every 75,000 population. Based on studies out of 2022, we know that we are short 194 rheumatologists across Canada. So that's an existing gap. And we have a workforce, some of which are retiring, some are burnt out. So we have people leaving the profession, which further compounds that issue. And the impact of that really is on wait times and access to care. So when we look at the 90th percentile, so the time it takes 90% of patients to see a rheumatologist, rheumatoid arthritis patients wait 5 times longer than the benchmarks. Spondyloarthritis patients wait twice as long, and psoriatic arthritis patients wait 4.5 times as long. Now that's nationally. We know that when patients have timely access to care, they have better outcomes in terms of their disease management and impact on disability. And when we compound the impact of rural communities, the health and resources shortage is that much more pronounced. And we have populations in Northern Ontario that have a higher incidence of our diseases as well. So we have an even more pronounced gap because we have a higher demand with sicker patients and less supply of the rheumatology force.
So both of you helping lead this initiative, our understanding is that you are now in discussions with the provincial government and the Ministry of Health. Um, what what are some of the issues you're discussing with them and some of the solutions that you're proposing?
Yeah, so Kelly, we've been in discussion with the Ministry of Health in Ontario for almost a year and a half, 2 years now, initially introducing some of the issues that Chandra raised in rural and northern communities. As part of the Northern Subcommittee, we also did an environmental survey of the different models of care that are providing care in our province. So whether that's in care, traveling providers, or a hybrid of the two. And based on this environmental survey and discussions with all the providers, we came up with a business model that we took to the ministry after we got stakeholder support. And this business model, asking for funding, really leverages the advantage or the benefits of something called ACPAC providers. And that's what Chandra is. So this is arthritis care advanced care practitioners in arthritis care. So ACPAC therapists are extended role practitioners. So their basic training may be in physiotherapy, occupational therapy, chiropractors, or nurses who have gone on to get additional master's level training from the University of Toronto, because that's the only school that provides it right now, in arthritis care. And this has been going on for over 15 years, the program out of Toronto. And the advantage of this is we've shown, and there's studies showing that the assessment of an ACPAC therapist of a patient in terms of active disease, diagnosing, and joint counts is very similar, if not the same, as a rheumatologist. And there's validation of this. So if we leverage ACPAC therapists in home communities with rheumatologists in other parts of the province, we can bring care closer to home for these patients in rural and northern communities. This is not groundbreaking. These models have been implemented in Canada, in our province, as well as internationally. And there's evidence to show that it works. So what we're proposing is a hub and spoke model. So we're asking the ministry to train and fund salary support for ACPAC therapists in major hubs in Northern Ontario. So this includes Thunder Bay, Timmins, North Bay, Sudbury, and Sault Ste. Marie, at least one ACPAC in each of these communities to serve that community and the surrounding areas, and work alongside 4 to 6 rheumatologists each in various capacities. That could be, again, in person if there's a rheumatologist in that community, or virtually if the rheumatologist is in Southern Ontario or elsewhere. What this allows for is the patient can be assessed in the community. We can trust the ACPAC's assessment, and then the rheumatologist can make management decisions. This will reduce wait times that Chandra talked about. It will allow us to get to treatment faster, which will prevent damage from the disease, better outcomes, keep people in the workforce, reduce the burden on our healthcare system, emergency visits, hospitalizations, and on and on. And there's a lot of evidence to support using extended role practitioners. So that's the essence of what we have put together over the last couple of years. We've taken it to the ministry through various presentations at Ontario Health, and the discussions have actually been quite promising, with potential funding support coming down in the near future, possibly, to implement a pilot and see how that goes. And we're just in those final discussions with the ministry for now, and keeping our fingers crossed that we'd be able to implement this and show that it works for people in Northern Ontario. Yeah.
One of the things that ACE has been working on over the past 3 years during the pandemic, when it really became more evident, is the whole issue around health equity, and particularly as it relates to Indigenous communities and Indigenous people living with arthritis. I'm wondering if that was, or if that is a component of this work that you're proposing as well.
Yeah, sorry, go ahead, Chandra.
Oh, I was just going to say absolutely. And we've had some partnership with ACE in that regard, and partnering really with local organizations that have established relationships in these communities. You know, fundamentally, we have belief that you shouldn't be limited in your access to care by where you live, and that needs to be supported. And additionally, respecting some of the traditional practices of Indigenous communities in delivering care to areas.
Yeah, and in consultation with yourselves, Kelly, as well as Dr. Cheryl Barnaby out of Alberta, we have a separate section on providing care through this model to Indigenous populations, recognizing inequities that briefly addressed. And we have brought that up to the ministry, and it will look different in different communities. So it's hard to kind of put a blanket statement how that will look in each model, because each community is different. As well as each northern hub would be different, but it's certainly been given priority in the business plan, and we've spoken to key stakeholders around that as well.
That's great. I think just on behalf of our organization, but our audience and people living with arthritis, we really want to salute the work that you and your team is doing. I think it's obviously vital, but it's also, I think, a best practice, a future best practice for other provinces to really look closely at, because the challenges that we're facing in Northern Ontario are no different really than in other rural and remote areas of Canada. So we want to thank you for showing the leadership in Ontario and for the rest of the country. I mean, it's a bit of a cliche, but it's really all about improving models of care to ensure that our people living with arthritis receive the right care in the right place at the right time. And the work that you're proposing with Ontario, we hope the Ontario policymakers have good news for you in 2023, will go a long way to achieving that. So thanks so much for the work that you're doing, and thanks for joining us today.
Thanks for having us.
For having us.
And thank you, everybody, for tuning in. And we hope to see you again on next week's episode of Arthritis at Home. Bye-bye.